Let's talk about shoulder pain. You know, it's one of the top reasons people end up at the doctor's office. It's that frustrating ache that can make even the simplest things, like grabbing a cup of coffee, feel like a huge challenge. So in this explainer, we're going to pop the hood on that complex machine that is your shoulder and figure out what's really going on in there when you feel that pain. You know the feeling, right? You reach up for something, maybe a book, maybe a dish from the top shelf, and bam! Out of nowhere, you get this sharp, nagging pain. It's such a classic sign that some part of your shoulder's intricate machinery is, well, it's not happy.
So to really get what's causing the pain, we've got to understand the shoulder itself. And trust me, it's way more than just a simple hinge. It's this incredible piece of biological engineering. It gives you more range of motion than any other joint in your entire body. So let's meet the key players inside this machine.
Okay, so everything starts with the bones, right? The foundation. You've got three main ones coming together here. The humerus, that's your upper arm bone, the scapula, which you probably know as your shoulder blade, and the clavicle, or your collarbone. These three create the basic structure for the whole joint.
All right, now for the powerhouse of the whole operation, the rotator cuff. Think of this as the engine. It's a team of 4 muscles and their tendons that basically hug the joint, connecting your arm bone to your shoulder blade. This is what actually gives you the power to lift your arm, to rotate it, to do pretty much everything.
And tucked right in between that powerful rotator cuff and the bone sitting on top, well, there's this really important little thing called the bursa. It's a tiny fluid-filled sac that acts like a cushion or a little oil packet. Its whole job is to make sure those tendons can glide around without any friction every time you move.
And finally, let's meet the acromion. This is basically the bony roof of your shoulder, sitting right on top of the rotator cuff. Now, you're going to want to remember this name because it is a huge player in our story of shoulder pain. It's often where the trouble starts.
So, we've got this amazing, beautifully designed machine. But what happens when it starts to malfunction? Where does the breakdown actually happen that leads to all that pain?
Well, usually the pain comes down to one of 3 main culprits. First, you've got tendinopathy. That's just a fancy word for when the rotator cuff tendons start to wear out and degenerate. Second is bursitis, which is when that little lubricating bursa gets all inflamed and angry. And third, and this is a big one, is impingement. This is where that bony roof, the acromion we just met, literally pinches or rubs on the tendon and the bursa underneath it every single time you lift your arm. Ouch.
You know, your body has its own set of warning lights, kind of like a car's dashboard. It's pretty good at telling you when something's not right. So let's talk about how to read those signals for shoulder pain and figure out who's most likely to see them flashing.
So, who gets this kind of pain? Honestly, it can happen to anyone, but some folks are definitely at a higher risk. We see it a lot in young athletes who are constantly doing overhead motions. Think swimmers, baseball pitchers, tennis players. Same goes for people whose jobs demand that same movement over and over, like painters or construction workers. But, and this is important, sometimes it just pops up after a minor injury, or even with no obvious cause at all.
And this is really key because the problem doesn't just appear overnight, it progresses. In the beginning, you might just feel a mild ache, maybe some pain that shoots down the side of your arm when you reach up. But if you ignore it, it can get way more serious. We're talking severe pain at night that actually wakes you up from sleep, a real loss of strength and motion, and even trouble with simple daily tasks like putting on a coat. The big takeaway here is to listen to those early signs.
Okay, so those warning lights are flashing. What's next? You got to get a proper diagnosis, right? Let's walk through how a doctor really investigates the problem to find the exact source of that mechanical failure.
So the first thing your doctor is going to do is just talk to you. They'll ask about your symptoms, your history, what makes it hurt. Then they'll do a physical exam, gently pressing on different spots to find exactly where it's tender. Next, they'll test your range of motion, seeing how you move your arm on your own and how they can move it for you. And finally, they'll test your strength to see if there's any weakness in those rotator cuff muscles.
And if the physical exam isn't enough to get the full picture, that's when they'll bring in the imaging. An X-ray is the first stop. It's great for checking out the bones and can show if you have a bone spur on that acromion. An ultrasound is amazing for looking at soft tissues in real time. It can actually spot inflammation or tears and even watch that impingement happening live as you move your arm. Then you have the MRI, which gives the most detailed look of all, showing every little bit of fluid, swelling, or damage. All right, so you've got a diagnosis. Now for the good stuff, the part you really care about, the repair plan. How do we get you back on track and feeling better? And really, when it comes to any kind of treatment, the goal is super clear, and it's twofold. Number 1, reduce the pain, obviously. But just as important is number 2, restore function.
It's not enough to just not be in pain. You need to get your shoulder working properly again so you can get back to doing all the things you love.
And check this out, because this is some really, really good news. For the huge majority of people, we're talking about 90%, the road to recovery does not involve surgery. Most people get better with a much more conservative, non-surgical game plan.
So what exactly is in this non-surgical toolkit? What are we talking about here? Well, it starts with the basics. Rest and changing up your activities to avoid the things that are causing the pain. Over-the-counter anti-inflammatories like ibuprofen can be a big help with the pain and swelling. Physical therapy is absolutely crucial. A good therapist will give you targeted exercises to get your motion back and strengthen that all-important rotator cuff. And if the pain is really stubborn, a steroid injection can be a game changer to cool down that inflammation and break the pain cycle.
So, when you boil it all down, it really comes back to this one simple question for you. That ache, that little twinge when you reach, that stiffness, it isn't just random noise. It's a signal. It's a message. So, is your shoulder trying to tell you something? Because understanding that message is always the first step to fixing the machine.